Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 46. We're going to finish with a summary slide about blood and tissue parasites, and then we'll talk about the helminths and start with the cestodes or tapeworms. This will be fun stuff, so get ready for it. Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 46, Blood and Tissue Protozoa. This table is a nice summary of the blood and tissue protozoa we've discussed, including Trichoparanasoma brucei, T. cruzi, Leishmaniasis, Plasmodium falciparum, and Toxoplasma gondii. This is a good thing to study. These diseases are frequently tested on USMLE, but not in great detail. So if you know the transmission route, the symptoms, the diagnosis, and treatment, you should be good. Let's talk about pathogenic helminth. Helminths come in two main forms, the cestodes, which are the tapeworms, and the trematodes, which are the flukes. With the cestodes, we have four different types that we need to be familiar with. The Diphyllobothrium, the Echinococcus granulosus, or multilocaris, the Taenia saginata, and the Taenia solium. You can see the associated animals from which we get the helminths. The trematodes are more flukes, and we have Clinorchus senescens, Paragonomus westermanni, Schistosoma mansoni, and Schistosoma hematobium. Again, these identify the organ that is affected by the infection. This is a list of the anti-helminthic agents we have available to us. There are a few of them. They all have unusual names, but it's good to be familiar with their mechanism. Most importantly, it's good to know what they treat. You'll often be given a clinical scenario where they tell you that it's a cestode or a trematode, and you'll be asked which medicine works. So if you are familiar with this table, you should do well. Let's talk about the cestodes or tapeworms. They have three basic portions. You've got the head or scolex with suckers and hooks. This helps adhere to the mucosa of our small intestine. Then you've got a neck section which produces the proglottids, and then you've got sections or segments of proglottids which are used for diagnoses and identified in the feces. Tapeworms are hermaphrodites, so they have both genders available to them. The tapeworm has no GI tract, and so they have to absorb nutrients directly from us. Let's start with Echinococcosis. Echinococcosis granularis is the dog tapeworm. It can form hydatid cysts in our livers, lungs, and brain. It's a common cause of hemoptysis, right upper quadrant pain, and a tender hepatic mass. The cyst will rupture, which really causes a problem, and then you get anaphylactic shock. It's transmitted to us where we get eggs from the dog or sheep feces. It lives in the dog passes it through its feces, and then we eat contaminated food. Diagnosis is based on CT or MRI scan, where we see the daughter cysts within the original hydatid cyst, and that's a honeycomb appearance, or we can get it through biopsy. You'll treat echinococcosis with albendazole, injections of ethanol into the cyst by CT guidance, or you can do surgery, but you don't want to rupture the cyst. Again, you'll cause anaphylactic shock. Taeniasis comes from Taenia solum, which is pork tapeworm, and the pigs are the intermediate host. Again, we have the scolex, and we get it from eating the eggs which are in the larvae or in undercooked pork. It causes diarrhea, abdominal discomfort, and malnutrition. Cysticercosis is an associated disorder where we get proglottids in the stool, and we also treat it with praziquantel and niclosamide. Cysticercosis is the pork tapeworm. We also get it from eggs or from human feces. It can cause seizures, headache, vomiting, and you want to diagnose this with a CT scan or get a biopsy tissue. Again, the treatment is praziquantel and albendazole or surgery to remove it. If you get cestodes taeniasis, you get Taenia saginata, which is the beef tapeworm. Again, you've got a scolex or a head with suckers, but it has no hooks. The transmission is you eat it or ingest the larvae in undercooked beef. Taenia saginata is a rare cause of cysticercosis, and the diagnosis is by identifying the proglottids in stool. You treat with praziquantel or niclosamide. Question. A 31-year-old Hispanic woman is brought to the emergency room after suffering a seizure at home. The patient's been a resident of the United States for 5 years, but occasionally travels to her previous home in the DR. CAT scan of the head reveals multiple punctate calcifications and 2 enhancing cystic lesions with surrounding edema. What's the most likely diagnosis? So this is somebody who's otherwise healthy, If you've got a ring-enhancing lesion in an HIV patient, that's a different animal. But if you have a healthy person with exposure to where the parasites are in the Dominican Republic, with ring-enhancing lesions and calcifications, you think of neurocysticercosis. Diphyllobothrium latum is the fish tapeworm. It's the longest tapeworm, and it can grow up to 15 meters long. We get it from eating the larvae in raw fish. It's diagnosed by finding the eggs or the proglottids in our stool, and it is associated with B12 deficiency anemia. This is something that's often tested on step 1. Remember, Diphyllobothrium latum, fish tapeworm, B12 deficiency anemia. Again, like with the other tapeworms, we treat it with praziquantel and niclosamide.
Let's summarize Module 46, where we had a summary slide on the blood and tissue parasites. We talked about Plasmodium and toxocariasis. Then we went on with the tapeworms. We talked about the helminths. We talked about Diphyllobothrium latum, Echinococcus, and Actinia, and also cysticercosis. You should be familiar with the basic morphology of a tapeworm, the different body parts, how it affects us, how it infects us, and where we get the organisms from. If you know the host animal, such as a pig or a cow or a dog, you'll be well on your way to identifying it in the question stem. Next up in Module 47, we'll continue with our helminths and talk about the trematodes as opposed to the cestodes.